Hi everyone, welcome to Gravitas AI live session. Today we'll be discussing about early adoption of AI in healthcare industry. Early adopters of AI technologies are poised to revolutionize patient care, improve efficiency, enhance the overall quality of healthcare services. To discuss more on topic, we have with us Dr. Sachin Bajaj, founder director of Ojala Cygnus Hospital, New Delhi. He is an experienced founder with a demonstrated history of working in health, wellness, and fitness industry. Along with him, we have with us Mr. Arsh Srivastav, business and AI strategist and co-founder of Gravitas AI. Welcome both of you to today's session.
Thank you. Thank you very much.
Thank you, Akshita.
Yeah. All right. So the first question with you, Mr. Sachin Bajaj, is like, can you please give an overview of your healthcare journey?
Yeah, I started out very early. I was studying to be a gastroenterologist when I dropped out to start this healthcare enterprise in the smaller towns because of some stories in our families that people could not reach out to the big city to access healthcare, and we had mortality on the way. So even today, if you see, India has more than 810 districts, out of which still more than 500 do not have access to tertiary emergency care. So if you're unfortunate enough to have a heart attack or a head injury or a critical illness in a small town, it is very difficult to access healthcare within the golden hour. You have to go to the big city, and that may take anywhere from 2 hours to 7, 8 hours, depending on where you are, how the traffic is. So this is how I also started. I dropped out and started the small town hospitals. Luckily, we had good doctors, good investors to back us, good people who understood and believed in the journey. So we have 23 hospitals now across 5 states of North India, Uttar Pradesh, Uttarakhand, Jammu Kashmir. We are still the only ones in Jammu, the first ones in Srinagar, Haryana. All these states have been consistently at the bottom of all human development indices and health indices like IMR, MMR, etc., life expectancy. In India compared to South India, we're still in the north, a lot behind in terms of healthcare indices. So this is where we work. We work only in small towns. Our hospitals are anywhere from 100 to 300 beds, all of them NABH accredited. So we provide the highest quality services. We use the services ourselves. I mean, it's not like we go to the big city hospital and ask the community to use our hospital. My daughter was born in one of our hospitals. My son has had two surgeries in one of our hospitals. So we are only in small towns. We work with communities who have financial access issues, geographical access issues. We work at extremely low cost, sometimes at cost which are even 20% of what the big city hospitals charge for exactly the same procedures, same outcomes, same quality parameters. Our aim is to expand these services and inspire more people to start such services, so that each and every town in India is, the access to healthcare is not dependent on where you live, how much you earn, or what your social status is.
All right, so it's good to hear like you are touching all the points across North India and providing this healthcare service, which is very crucial in the rural areas as well. All right, moving ahead with our next question. So, how do you see AI shaping the future of healthcare, and what are the key factors influencing the adoption of AI in healthcare?
So I think technology is the only way how we can, achieve our dream of providing healthcare access to each and every individual in the country. If we want to provide access to 1.5 billion people, just depending on manual interventions and doctors to do all the treatments, I think it will take many years, maybe hundreds of years to achieve that. So technology is the only way we can do that. When we started out, even a simple thing like transmitting a photo was considered to be impossible. When I started out, I had to, work as the clinical head as well as the administrator, as well as each and everything in the first hospital. So I used to call myself P2P, PN2 promoter. So I remember traveling, at night, sometimes 3 a.m. I would have to travel 2, 3 hours to, go and see a normal ECG because the residents were not very confident. They would call me that this patient is not improving. We've given some injections. ECG, we don't really know. It's not really normal, but not also abnormal. So ECG is very difficult to read, right? I mean, it's notoriously difficult to read those squiggly lines and make a perfect diagnosis. So I would then go up and travel and go in the night and see the patient, and the ECG would be normal. So the first time I came across WhatsApp was some doctor introduced me that this, why do you travel? We have an ECG transmitting software in place now. So I said, what is that? They think it's called WhatsApp. You can take a photo of ECG and transmit it. So this is how we got exposed to these kinds of technologies first time. Now we use technology in a lot of things. AI is used for diagnosing our CTs and MRIs during night times, off times when radiologists are not available easily. The ECG, as we said, AI is used to diagnose immediately. So we have these ECG machines that we can distribute to the kasbahs and the small clinics around our hospitals. Again, the same, those doctors usually are either quacks or BMS doctors, or practicing without formal degree, so they also find it very difficult to read those ECGs. So we do the ECG, the machine reads that ECG, and in case it's an abnormal ECG, it immediately escalates it to a cardiologist sitting in Bangalore, whose company this ECG machine is of, and they vet that the ECG is abnormal. Then they transmit the report both back to that machine and to us as well. So sometimes
Mhm.
we are the ones calling that small clinic that you have a heart attack sitting in your clinic right next to you, on the ECG machine. So please start this treatment, and we are sending an ambulance to you. So it's saving lives. It's giving confidence to that practitioner that he can serve more communities, as well as it's increasing the business funnel for our cath labs that we can source those. So it's like a win-win for everyone. We have AI and ML incorporated in our WhatsApp chatbots now. So using these LLMs, so you can actually converse with the chatbot in a Hindi or English, your own language. You don't have to press one, press two every time and be confused what is going on. So you can just say, I want my reports or I want my appointment, and the
Mhm.
chatbot understands and starts responding to you and can arrange appointments. So the implementation, I think, has been slow but very steady. Uh, COVID has, of course, given a big fillip to technology, and now I think we are at the cusp of something very revolutionary coming in. See, healthcare practically now is, I think, the only industry that has not become completely unrecognizable from what it was, say, 10, 15 years ago. Unlike every other industry, banking, if 15 years ago somebody had told me that you would be able to buy a shirt or a shoe without trying it and without going to the store or the mall, and it would be delivered at home, I would have like, this is not possible, right? How can we buy without trying, fitting, feel of the cloth, fabric? But it's completely changed, right? You can sit, shop at the comfort of your house, keep buying, keep returning, keep buying more, so till the time you're confident that I think healthcare, the naysayers still feel that it's impossible. You need to feel the touch of the doctor needs to examine you. But I feel this is exactly the same as when we convinced ourselves that we need to touch and feel the fabric and the fitting, etc. I think this is going to change. We are at the cusp of it. Banking has changed completely, unrecognizable from what it was 15 years ago, when you had to go to the bank to get your passbooks updated, to withdraw money, to deposit money. I don't think any of the viewers would have visited their bank in the last 6 months even once. Everything is on your mobile, right? So
Yeah.
there's something that is going to happen. I'm sure it will happen within the next 2, 3 years. We are at the cusp of it. We already saw in a hospital very close to one of ours. So the Rajiv Gandhi Hospital, they installed a robot, and the first surgery was done by a doctor sitting 40 kilometers away in the Gurgaon head office of the robot company. The surgeon sat there and operated on the patient in Rohini. So these things are already out of science fiction now, becoming more and more commonplace. and I'm sure we will see that being implemented at a much more rapid pace in the years to come.
Yes, of course.
Yeah, that's really
So,
true. But yeah, and I really think that's an amazing explanation of and covering all the areas, not only the patient experience but also the operational side plus clinical aspects. So there's a lot of opportunity out there in terms of utilizing, and there are multiple use cases which can be put forth to draw that convenience. Basically, when I define, like I try to define it, I'll try to define it in a framework which is a ACS framework. So access, convenience, and seamless service, which can be definitely obtained through this, because all the blockages and the limitations which we have as humans can be filled in by this particular technology. If we are trying to mimic the right kind of use cases and trying to understand the full user journey, wherein we need to put in the technology and where we don't need to put the technology as well. So both sides are very important, so that we totally embrace the technology in a way that it is ethical, it is providing the right kind of experience, and not only just providing the right kind of experience but also solving the right kind of things for us, and also taking care of things which the technology should not intervene in. So yep, I think it's very as you said that it's almost there, and 2 3 years time there will be a lot of revolution. So there are multiple factors which are influencing the adoption of this, and I think the way the industry was structured or was not in the front. So that is something which has been a really key factor in terms of influencing more adoption of AI. And the results are really amazing, because after COVID we all have learned that health is something which needs a supreme care. It has to be in the forefront. And prior to that, I it was there definitely, but I don't think everyone realized the value of that. So that value relation has come into picture, and then we are trying to focus more on this particular sector, and there's a lot of opportunity which will take the sector multiple times forward with the help of technology. It should be seen as an assistive technology, because no technology can replace doctors, because ultimately the doctors are the main source where people will go to. But yeah, wherever the assistance is there and that can be provided through technology, that should be there.
all right. Of course, along with the doctor, patients are also increasing this demand of personalized care and, of course, faster access to information. So AI can also meet these expectations by providing them tailored kind of recommendation and improving communication, like the multilingual factor through this chatbot, WhatsApp chatbot, or the web chatbot, is helping patients a lot. All right, moving ahead with our next question. So, what are the specific challenges and opportunities for implementing AI powered solution in rural healthcare settings?
So yeah, I can take that. So see, I think I can start, and then maybe you can add on to it, because you've been at the forefront of AI implementation. We are just the users. I think you are the pioneers in it. So I can start off and then maybe listen to a more nuanced view from you. So, see, in the rural and the semi-urban settings, the most important thing is availability of devices and bandwidth. Right, that is the first thing. Right now, in most of the families we see, they would have maximum of one device shared across all four or five of them, and that device is usually owned by the male member of the family, who's usually the bread earner as well, and he will go in the morning to the factory or wherever he goes, and he will take the device along with him, and the device will be back only in the evening into the house, where then the children and the wife can use it for their education or entertainment or something. So availability of that, and second of bandwidth, we need, obviously 5G will bring a revolution, I feel, but right now bandwidth is constrained. Cost not so much. User readiness not so much. I think everybody is very savvy with devices now. As long as one framework ACS was given, I think however is that if it saves them either money or time, or gives them better outcomes in terms of emotional or financial benefits. So either of these two, or physical benefits, so they will use it and they will learn it very quickly. We saw it when Uber came into India and Ola came into India. You had concerns that how will small town drivers learn this app, it is very difficult for them. It will be not be a success because they are not technology ready. And you really saw when the salaries of drivers was really high in the beginning, when they were subsidized to a great degree. You had people coming in from villages getting into the big cities, Delhi and Bombay, learning the app in less than 2 hours and being on the road the same evening driving a cab. So they will learn, the doctors will learn, as long as I said, it saves you either time or money, or gives you better outcomes physically, financially, emotionally, however. If it gives you pleasure, if it gives you laughter, if it gives you health, people will use it. So user readiness is not a problem, I feel. But the problem is availability of devices, availability of bandwidth, and making sure that we can proselytize and market the right technologies to the right people at the right time.
Yeah, totally agree with that, and I think that opens up a bit of eye for me as well in terms of like the kind of example which we heard about the devices are not available. So that is something which can be thought about, because then actual the main problem becomes the unavailability of devices rather than the technology implementation. From an implementation standpoint, in that case, I think uh, it's more important to have more user research, more listening in sessions, and focus group discussions with the stakeholders who are involved, which are the actual stakeholders in the rural areas, to understand their points. Because as with the technology evolution, we have tried to conquer a lot of things, and we can conquer a lot of things, whether it's in terms of like conversations or automations or data insights or maybe predicting things, etc. Doing clinical research, robots are coming to do operations, etc. Everything is going on, but the real person who's trying to get who wants these things, who needs help on these things, I think that is a point made as well. So that though that person is not being heard. So it's for also not only for hospitals but also for technology houses like us to understand more that okay, we need to actually be in the ground, understand the real from the pain points from the real person, and then try to come back to the hospitals and try to like coordinate together so that we can collaborate and bring in solutions which are the right kind of solutions for them, rather than just getting a technology solutions out.
Yes, of course. So here as the next question I have with you, doctor, like how can conversational AI help address the shortage of healthcare professionals, particularly in specialized fields like mental health and chronic disease management?
See, we need to be very clear that, as I said in the very beginning of our conversation, that if we are dependent on doctors to lead healthcare, it will be impossible to provide accessibility, affordability, accountability to the billions of people that we have and the millions who are still out of all safety nets. So, technology is the only way to go. India has, say, 85 million diabetics now. And for these 85 million diabetics, we are only producing 67 endocrinologists every year. So, how do you imagine that an endocrinologist can see all diabetics and provide them the best care, right? So, this is why now what is happening is we are not managing diabetes well, we are not diagnosing diabetes in time. We are diagnosing diabetes only when they start having complications, when their blood sugar is 400. So, that is why one third of all diabetics in India end up into kidney failure. It's a huge number. And we have known this number for many years, and still we are unable to do anything about it. We are amputating 1 foot every minute across the world, and 1 foot every almost 4 minutes in India due to diabetic complications. So, when that happens, the cost of the disease rises many fold, right? Because we have to see both the direct cost as well as the indirect cost, and then estimate the intangible cost also. The direct cost is because you are in kidney failure, you will have to have dialysis twice a week, you will have to take medicines, you will have to, fall sick occasionally, off and on, visit the ICU because of kidneys, all of that. Indirect cost is because you are undergoing all this, you will be out of a job now, you will not be able to go to the factory and work, you will not be able to visit the fields and work, and your future earnings that are lost run into hundreds of thousands of dollars compared to the amount that you had lost in the hospital itself. And the intangible cost is because now you're not working, you will pull your children out of school and start sending them to work, right? So many future generations will be destroyed because you could not manage your diabetes, because you could not visit a doctor because the doctor was too far or too busy or too expensive for you. If you were to have some sort of support in this, right? So this is how conversational AI, especially as you ask, can help in this. That if I could ask a bot or my phone that, I have diabetes, my blood sugar is 250, what should I eat today? How much should I exercise? What are the warning signs that I should look at? The doctor can also tell you that, these are the 5 warning signs. Or I can try and understand that what are the blood parameters in the very beginning of a diabetic patient that can lead to kidney failure 20 years down the line. So now I have enough computational ability to understand all these patients, which I did not have earlier. So I can visit the records of all of them 20 years ago, of all kidney failure patients today, and see these were the 3 or 4 early warning signs that are common to everyone with kidney failure now. So now we can point out these people who have those signs now and work on them harder, make sure these are the people we are focusing on so that they don't end up into kidney failure later. So these things are very, very important to manage chronic disease like diabetes or hypertension. Also, diseases in which there is a social stigma. So, mental health has a social stigma, sexual health has a stigma, sexually transmitted diseases have a stigma, where patients are averse to going to a doctor physically due to some social shame or inhibitions in interacting face to face with any person regarding this. We have seen cases where even the husbands don't know that, their wives have fibroids or prolapse uterus. We go to a village, do sehat chopals, and we see a woman with prolapse uterus, and nobody in the family knows because she's too shy to speak about it, right? So these are the cases where these models can work, where, as I said, if we can solve for enough devices, enough interactive points where patients can interact with these LLMs and these AI bots, if we can solve for that, then many of these diseases, many of these processes can be helped, and there can be a lot of solutions coming out of that once we have enough numbers and data in place.
Definitely, I think that's something which is very important to address, and the shortage of healthcare professionals, especially like as the cost factor comes into picture, and also the accessibility comes into picture. So AI tools have a lot of power, which can definitely help in these areas. Can at least start working towards the BAUs first. Try to sort out the first level of interactions with AI, and then slowly move on with a strategic roadmap towards having more robustness to solve much more complex problems. For example, we did one chatbot for one of the psychiatry-based start setup, and so we were screening the chat through the chatbot. We're screening whether the patients need a psychiatrist or they're happy with it. They should be happy with the therapist. So these kind of screening questions, trying to understand what kind of arrangements do the patient need, what kind of support system which they need, or maybe going to the next level, as you mentioned as well, that about understanding more about the disease, giving more information about it, trying to provide the right kind of assistance, not only providing the assistance but also there are other aspects which are including how to support the daily life of people who are suffering into that area, how to support through friends and families, because we're talking about these kind of areas where people are shy to talk about, then a support ecosystem also sometimes work, because some people open up to some people and some people open up with a lot of people, so they're different type of people. So ultimately, if people who are not opening up or shy, so if we're able to provide some assistance through bots, or maybe open up some conversations, or educate, or let the people who are near to them or supporters or carers aware of the things which actually will help them, so that also will be a great help in that regard. So I think these are the areas which definitely can be helpful in, especially in areas like mental health, etc. And there's a lot more to explore. As I'm going through the session, I'm also gaining a lot of insights from him, so that we can start thinking on those lines.
Yes. So it's beautifully explained by both of you, like why it is important. And with this, we come to the last question. So it's a myth that AI is not suitable for rural or undeserved area. So anyone can give you a reality check to it.
I think he's already must, and that myth has been
I think
busted
it
already
is
by.
most, yeah, it is most important for underserved areas. That is where the real need is. That is where
Mhm.
doctors are not present. That is where physical infrastructure is difficult to create. So this is where technology will be proving to be a great leveler. Right now, healthcare is very, very skewed in favor of those who live in big cities, who earn a lot, who have a high social stature. So if you want to democratize healthcare and make it completely disconnected from your financial, geographical, or social status, which is what our mission is, I think technology, AI, ML, they have to be at the forefront of this change.
I totally agree to that, and can't agree. I can't add anything more on top of it because this is the area where it needs the most of the attention. And with technology, we can penetrate. We can get into the right areas. We can provide the right kind of support. We have to look into accessibility. We have to look into how we can provide this information or support on scale, and make it easier for them to access the information or the support they need. So yeah, I totally agree, and I don't think this myth is correct.
Awesome. So with this, we comes to an end of today's session. I would like to summarize that why it is important, like early adoption of AI in healthcare industry. So it was beautifully explained by Dr. Sachin Bajaj and of course supported by Mr. Arsh Srivastava. So thank you, Doctor, for giving a valuable insight on the topic and giving us your valuable time. Thank you so much.
Thank you very much, Akshita. Thank you very much, Arch. It was great seeing you. Hope to catch up soon next time whenever
Definitely, definitely.
you're back in India. Whenever I
Yeah.
am in London, I will definitely ping you.
Thanks a lot, and really looking forward to meet you. Yeah.
See you soon. Thank you.
See you.
Bye.
All right.
Okay. Bye bye.
Thank you. Bye, Doctor.